This video is part of Blue Frog Wellness's educational series on traditional Chinese medicine. It is not medical advice, just information to help you understand your body and your options. You might not believe this, but an entire map of your body is reflected right here in your ear. And by placing just a few tiny needles into specific points into the ear, you can calm the entire stress response, the one that gets stuck in the on position after trauma. So how does that even work? Let's break it down. Today we're looking at how ear acupuncture resets the nervous system, the fascinating history behind it, and how it's evolved into modern trauma recovery protocols, including ones we use with first responders today. When we experience stress or trauma, the body's fight, flight, or freeze response, that's your sympathetic nervous system, can get stuck in overdrive. Heart rate rises, digestion slows, sleep gets disturbed, and over time, the body forgets how to relax. The ear is special because certain points are connected to the vagus nerve, which sends signals to the brainstem, the part of the nervous system that regulates stress, relaxation, and balance. Stimulating these points sends gentle signals that help the body shift back into a calmer, more restorative state. The idea isn't new. The Chinese were writing about the ear's healing power more than 2,000 years ago, mentioned in the classic texts of Chinese medicine. But modern auricular acupuncture really took shape in the 1950s thanks to French doctor Paul Noget, who mapped the ear like an upside-down baby after noticing how points on the ear affected pain everywhere else in the body. In the early 1970s, a group of Hong Kong physicians began using auricular acupuncture combined with electrical stimulation to help patients withdraw from opioid addiction. These physicians first published their findings in 1973, describing how auricular acupuncture combined with electrical stimulation significantly reduced opioid withdrawal symptoms. This paper triggered global interest and is widely considered the first formal, peer-reviewed publication describing auricular acupuncture for addiction treatment. Then, the technique took root in the Bronx. Members of the Black Panthers Party and the Young Lords began using it to help people recover from heroin addiction when other treatments weren't available. That became the NADA protocol, or the National Acupuncture Detox Association protocol, which consists of 5 ear points that are still used worldwide for stress, addiction, and trauma. Later, the US military developed battlefield acupuncture to manage pain in combat, and then the Helms Institute designed the Auricular Trauma Protocol, or ATP, to calm the nervous system after crisis events. So what's actually happening when we treat the ear? Each area corresponds to a different region or system, like a micro map. For example, this point here, Shenmen, calms the mind. This one, sympathetic point, helps relax the stress response. From a Western perspective, these points connect to nerve endings that communicate with the brain's emotion and regulation centers, including the amygdala and the hypothalamus. Stimulating them releases endorphins and serotonin, while activating the parasympathetic nervous system, your body's rest and digest mode. Building on that history, we developed the Ear Acupuncture Resilience program, our evolution of these earlier protocols. Instead of using the same 5 points to treat everyone, we begin with the ear reading, which is a quick, non-invasive assessment that shows which areas of the body are under the most stress. That allows us to tailor treatment to each individual, restoring the balance where it's most needed. It's been especially powerful for first responders and trauma survivors who need to regulate their nervous system quickly and effectively. Now, researchers are still debating exactly how this works, whether it's neuronal or hormonal or energetic. The body of evidence keeps growing. Across hospitals, disaster response teams, addiction recovery centers, and trauma recovery programs, ear acupuncture consistently helps people feel calmer, sleep better, and recover quicker from stress. So the next time you feel stuck in survival mode, remember, your body already knows how to find balance. and ear acupuncture will simply give it a pathway home. I'm Vanessa, founder of the Ear Acupuncture Resilience program, and this is how we're helping people rebuild resilience one ear at a time. If you'd like to see what a session might look like or learn more about how traditional Chinese medicine or TCM can help support stress and trauma recovery, check out the links below. Thank you for watching.